Good afternoon. I am Charlotte Rowe. I am the Markel Care Practice Manager for Markel Care Practitioners. I want to talk to you about COVID-19 emergence, and specifically in relation to adult services, recovery planning and responding to change. Essentially, this is about business resilience and looks at strategic ways at which you can ensure that your business survives through COVID-19. Markel Care practitioners are around the UK. We have 30 who continue to work virtually with clients across adults and children's services. We've had contact with lots of clients during the COVID-19 period, and we will look to continue to support Markel clients during this period. I want to look at specific aspects that support business resilience and give you some key pointers in where clients can be supported further and things that we have learned across the adult social care sector from the work that we have done with our COVID-19 toolkit, recovery planning, risk assessments and PPE competency. This is included of recovery planning, and whilst the adult social care landscape is very diverse, all businesses need to consider recovery, whether that means continuation under the current restrictions or whether that has been a business where staff have been furloughed and services can no longer continue. It's important that you put in that proactive work and make a plan to transition back to returning into supporting the vulnerable adults across the sector. Risk management is something that we do across adults and children's social care, but specifically in relation to COVID-19 and factors that do need to be considered. One of the most popular discussion points has been government guidance, PPE and Infection Control. And whilst there is government guidance on this, we understand that people have had difficulties in regards to supply and demand of PPE, and we're looking at ways in which we can support clients across the sector in regards to these elements. The final aspect is liability reduction. Of course, there continues to be the potential for claims for any of our clients, and we continue to want to provide support and understanding and bolstering the defendability of claims that may come in. So adult social care. There's been a massive focus on adult social care, and it has been at the forefront of the COVID-19 response. While hospitals continue, many of the issues that have been seen have been across the adult social care sector. However, it is worth noting that it is a diverse sector. Whilst there are care homes, there are provisions for LD, mental health, adults with different vulnerabilities, services that are day services that have not been able to continue during the period and had to diversify. One thing that is worth bearing in mind that any support given in relation to COVID-19 needs to be bespoke and unique to your service. There is no one size fits all for adult social care. Many of our clients and the services across adult social care have experienced different levels of business interruption. What that means to you is unique to your service. However, business interruption has certainly happened across the sector, whether that be restriction on visitors, on activities, or actually furloughing staff. It is important that we prepare for the new normal. Adult social care is an essential part of the social care system across the sector and across the UK. And the new normal allows us to function and provide services for the most vulnerable in society. The way that businesses are enabled to do that is through creating business resilience. And essentially, this presentation will look at the key factors for you to achieve this. Across the weeks and months, and potentially the next year, COVID-19 restrictions are likely to continue, and it may change the underpinning elements of our practice to some extent. So it's important that as a sector, we remain resilient, we remain supportive, and essentially we continue to provide a service to those who are vulnerable and in need of the care and support we give. We have broken business resilience down into 5 key points. These are points that we have found through the support we've given as Markel Care practitioners, are generally the inquiries that we've been given. Some elements may be quite complex, others may be referring to government guidance and advice. Recovery planning essentially is looking at how you move forward from the emergency plans that you've made through your business continuity, and how you return to being a functioning business again. That all depends on your level of business interruption. Risk assessments are something that we have done continually and excel out across the sector. However, there are specific risks in relation to COVID-19. PPE has been a subject of much debate, and whilst there are continued improvements in supply chains, running levels of competency and ensuring our staff understand how to use PPE and PPE failures will help defend against potential claims in the future. Guidance has been diverse, depending on what sector of adult social care you are in. There has been significant advice available for care homes and dom care. However, for more community-based and mental health services, there has been a distinct lack of guidance that understands the nuances of this service user group. Furthermore, we will look at generalised liability reduction. All of these 5 key areas provide business resilience. As part of this presentation, I have also used testimonials and case studies to demonstrate what we as Markel Care practitioners have done and enabled us to support clients across the UK. Recovery planning. This is all depending on where you start and where you seek to finish. These are the 2 questions when I'm supporting clients with recovery planning. I asked, where are you now and where do you look to be in the next month, 2 months, 3 months, 6 months? Can your business survive? One thing that's become essential is consultation. That's not just consultation with stakeholders and commissioners, but also your workforce. Much of what we've seen is fear and difficulty for those who are providing the work and support for the vulnerable adults in our community. It is essential that you continue to communicate with your workforce through your recovery plan, and this will enable you to make informed decisions on a phased approach, about what you need to do next and what are triggers to those actions. Staff needs. It is important with these we support our workforce during these difficult times. And whilst the feedback I've got is that critical mass and staffing issues have been much lower than expected due to the resilience of the adult social care workforce, this will continue to be issues. As public guidance may loosen restrictions, this may mean that there are more potential risks for the important and key line front working staff that do attend and work for you. So it's important that you consider this. It's also essential that you maintain training during this period. Any changes to policy, practice, or process need to have adequate training and be signed off. Anything that is mandatory training continues to need to be delivered. Supply chains. Whilst PPE has been the focus of this, it is not the only thing that services are struggling to get hold of. And it's important that you look at levels of procurement across your service and how you intend for the longer term to procure those things. This is anything from environmental to service users' needs, clothing, food. So it's important that you consider this. Governance. Governance is a key factor in decision-making and in recovery planning. We know that most services across adult social care have regular governance meetings. For services that continue to operate, these normally remain daily, with updates to the board maybe once, twice a week, now that we're coming out of some of the tighter restrictions. The ability to consider up-to-date advice to make decisions on the best information is central to good governance. And it is important that you are able to access correct guidance, which we'll look at later in the presentation. Competitors and diversifying your statement of purpose. Well, each adult social care provision has a unique nature of what you do. You generally fall into a sector. It is important that you understand what your competitors are doing and what good practice guidance is available for ways and means of operating your business. Whilst there may be a competitor down the road that is doing one thing one way, that doesn't mean that you have to follow suit. It's important that you consider the nuances of your business and the services that you provide, both currently and look to provide back again in the future. Many of our community services have seen furloughed staff and have been unable to offer provisions. Therefore, We have seen many of them look to make virtual support, and they are diversifying ways and means which they can contact service users and their family. It is important to consider this in regards to your statement of purpose, how you support these through staff, and look to see if you can diversify, which enables you to return to a new normal slightly more quickly. We recommend transitional or phase planning. Phase planning is a stepped approach. What is key to phase planning is looking for triggers for move to one phase to the next. For example, you may want to move from one phase to the next when certain restrictions are lifted. But when will those restrictions come about, you may not know. However, you can still plan for the future, because when those triggers are satisfied, it moves you from, say, phase 1 to phase 2. You also need to be able to move forward and backwards between phases. Should the R rate increase and the potential lockdown measures and restrictions also increase, it is important that you can move backwards through your phase and transition planning to ensure that you're managing risk appropriately. Recovery planning is something that we are doing quite a lot of at this moment, whether it be looking on ways of diversifying or working specifically with organisations who have had to close or limit what they do during the period. Recovery plans need to be personalised and they need to be scenario tested and clear gap analysis presented. Recovery planning is not static. It needs to be reviewed under your governance strategies and amended with up-to-date data and consultation with service users, stakeholders, multi-agency partners and employees. Risk management and assessment. We are great at this across adult social care. It is something we do daily. There has been considerable risk assessment in regards to risk to employees who have maybe vulnerable health conditions, risk of service users. It's important to also consider in these risk assessments risk from employees to service users, risk to and from one to another. As there are more restrictions being listed for the public, it's potentially advisable to consider the potential risks of logistics, staff travelling to and from work, using public transport, and in addition, risks from the public. Is there a potential that if you are a community-based organisation that you are using a shared space? If you use offices where other people may be involved, what are the risks to employees? Will there be service users on premises? It's important that you don't just do one risk assessment for COVID and that you continue to review this as part of your governance strategy. Risk assessments also need to be considered with environmental risk. Fire risk assessments, environmental risk assessments have not stopped, and regulation still supports that they need to be undertaken even in these difficult times. What is essential is if you have third parties visiting sites, that you ensure that you have a duty of care to your employees, the visitors to your site, and in addition to your service users. It's important that you work jointly to undertake risk assessments. Considering the different ways that we are having to work due to COVID-19, where there is updated guidance, there should also be updated risk assessments. These need to be reviewed regularly and signed off by your governance system and oversight through QA. Vulnerable staff and service users. There have been significant questions about staff returning to work who have previously been shielding or have caring responsibilities. It is essential that you undertake specific risk assessments, that you consider your duty of care to employees and service users, that disclaimers do not work and do not negate this duty of care. Further information and in regards to specific issues that are presenting can be given through Markel Law and the Markel Law Advice Line and the Markel Law Hub. Health and safety does continue. The HSE website continues to be a great source of information. It's important, even if you are operations and based in practice, that you understand the elements of health and safety and you tier that training down to your front-end staff. Training must continue and being safe within the workplace is essential. We have assisted many people to undertake health and safety assessments as well as risk assessments. Markel Care practitioners have a specific COVID-19 risk assessment that we work specifically with clients to undertake. This is bespoke to the service, as no services across adult social care are generic in nature. Again, it is important that you consider the risk to your service, not a generic risk assessment. PPE and infection control. PPE has been a source of great discussion. In general, we are now in a situation where PPE is now available. Those who've continued to practice during the COVID-19 period have generally been able to stockpile PPE. While there was initial issues in the beginning, these have subsided and people have ordered in advance. A lot of our clients who work across the UK have created PPE hubs, which allows them to logistically transport PPE to areas where there may be deficits. It is really important that you follow the guidance in respect of PPE for your sector. Whilst we are aware that not every sector and every service user type across adult social care has specific guidance, where you are unsure, you must check with Public Health England. There is no such thing as an interpretation of guidance. The guidance is clear. PPE and where it must be used is also clear. However, the nuances of your service, or whether your service has multiple pathways or streams, may mean that its use may change between those different streams. Where there are staff in different streams or moving across those, you must think of your infection control measures. If you're planning to return to work and staff who have been remote working or planning to turn to an office building, consideration must be made not only of social distancing in the workplace, but also the logistics of going to and from work. For many people across adult social care, in the clinical elements, infection control is something that is embedded within practice. For those who are not, this is an area that can present a lot of uncertainty. Again, local authorities, local NHS trusts, and Public Health England are there to support you. We recommend that considering government guidance is a minimum. If you work to that effect, use of PPE will always be satisfactory. You must also consider where there is PPE failure. What happens when it doesn't work? What happens when you are restraining somebody and the PPE is pulled off? It is essential that you have PPE training and that you roll this out so there's a competency across your workforce. Markel Care practitioners have designed a PPE competency. Think of this similarly to the test that we do for people who are dispensing medication on site. It allows us to know that people know how to use PPE, what session use of PPE in public, whereas you may be considered a household within the four walls of your provision, you may be, when you're outside, need to use PPE. And it's important that you consider this. We are aware there's been significant issues in the use of PPE with learning disabilities. The Social Care Institute of Excellence has provided some excellent guidance on this, and I would direct you to this. Also consider how you can phase in PPE and how it will affect other risk elements of your practice, such as increased behaviours such challenges and restraints. It is important that you consider vulnerable staff and service users. Where guidance changed, again, we must do new risk assessments and consider the potential risks of us using different means of protecting ourselves through PPE. If you are using face shields, goggles, masks, if you are no longer required to, what is the risk of not doing so? And where do you not do so, and where do you need to use them? So it's really important that we consider scenarios in the use of PPE infection control. Government guidance. There has been significant governance guidance over the period. For many of our clients, we have found that there is not specific government guidance that relates identically to their service. This can cause significant confusion. We have noticed that certain areas of the adult social care have mixed and matched guidance, and it is important that you review as much guidance relative to your service user group as possible. The government site does an email alert system, which will let you know when new guidance comes through. One thing is worth bearing in mind. It is not just enough to look at your sector. If you interact with other agencies and the public, it is important that you also understand the guidance that is given to them. This needs to be integrated into your governance structure. It is important that you continually review and ensure that you are looking at up-to-date guidance. While I know this can be scary, and finding the right guidance and the version of the guidance may be some level of uncertainty, all guidance on the government site is clearly said at the top whether it is continued or has been defunct and you no longer have to use it. If you do use the web links, these will update themselves, and it is worth embedding those within documentation so that when you are having governance meeting or in preparation of, you can read and ensure that guidance has not been updated. It's not just enough to look at guidance. Across adult social care, we have lots of associations, best practice guidance hubs, Social Care Institute of Excellence, other providers that provide information and advice. There is lots of information going up daily, and it is worth looking at the lead professionals in your area. So take this as part of your governance structure. It is not just governance guidance, but best practice guidance. Again, governance guidance is a minimum standard that should be employed. Liability reduction. So, unfortunately, just because there's COVID-19 does not mean that there is not the potential for claims. We've spoken previously about staff training and competency. This is essential and must continue, whether it's mandatory training or training due to the changes in policies and practice. You need to ensure this is disseminated to the workforce and that this can be applied in practice. Continue to get staff to sign that they have read any changes. Continue to ensure that you update staff swiftly after any changes are made. Make sure that you do hold training regularly. Many training providers, if you do not have in-house provisions, can provide remote training. Currently, Markel Care practitioners are providing training through remote means, and we are still able to offer that facility. Policies. It is important. Whilst initially there may have been an overarching COVID-19 strategy, if policies have changed over the period, you need to ensure that these are written up. You may wish to add additional information to the end of a policy saying how it has been updated in COVID-19. It is not enough that this is just done and kept in a file on your computer. This must be disseminated through your managers and to frontline workforce so that they know the changes. Communication is essential. Do not just email and expect people to read it. You need to make sure that people are actually able to understand what you are asking of them. There are so many changes that have come through COVID-19, and sometimes, just as in guidance, we don't know what version of a policy or process we're supposed to employ. Again, the use of a PPE competency or a competency-based system can test out whether an employee or a process has been fully understood. This then, in respect of claims, can provide a defence. Understanding the impact of change. There is so much that has changed within COVID-19. There is so much pressure that has been put on our workforce. A workforce that previously went under the radar. Now people understand a little bit more difficulties in adult social care. However, the workforce is impacted, not just in regards to the difficult job they do on a day-to-day basis, but on a personal level. Many have faced loss, caring for other family members, have children who are now at home. It's really important that we look after the well-being of the workforce and that you undertake a test of how your workforce is emotionally doing. Whilst we use supervision quite readily in adult social care, this can be a really good place to consider how employees are feeling on an emotional basis. But we must be considering about the impact that they may have on practice. Regular surveys, feedback, pulse surveys are a really good way of seeing how the workforce is doing. And remember that any change moving forward must also consider the risk of implementing that change. Planning and governance. It is really important that you keep records of what decisions are made and why those decisions are made, coupled with competencies and risk assessments. This is essential to building resilience and forms part of your business continuity and recovery plan. Markel Care practitioners continue to deliver liability reduction training, and this continues to be a key aspect of what we do. Obviously, this has been updated to include COVID-19. Safeguarding and regulation. There has been lots of changes in regards to regulation, whether it be visits by inspectors on sites or changes in the implementation of the Medical Capacity Act. These are interim measures, and it's important that we understand what the regulation landscape currently looks like, from HSE to our governing bodies, to regulation in regards to professionals such as nurses, social workers, where there has been different levels of tests made on professional values and ethics and people coming into the workforce. We must make sure that decisions that are made by regulators are filtered into policies and practice. There has been reported difficulties through some of the adult social care in regards to contact with local authorities and safeguarding hubs. Whilst many social workers and local authorities are now working from home, there has been pockets across the country that we have seen difficulties in communication. It still remains essential that you notify any concerns. You continue to communicate and highlight any safeguarding issues, both from a notification through insurance perspectives and also notification to safeguarding agencies. Staffing and safeguarding. It remains essential that in COVID-19, that safeguarding training and understanding is at the forefront of our practice. This has not changed. Ensure that any staffing issues or stress on staff does not lead to increased issues in regards to safeguarding and professionalism. Ensure that you understand what regulators are currently asking from you. If you're unsure, you may contact regulators. They are more than willing to give advice and answer questions. Markel Care practitioners. So across the UK, we have 30 practitioners. They have different areas of expertise. We have developed, as Markel Care, specific COVID-19 tools. This includes risk assessment, business continuity, PPE competencies, recovery planning. All our training is currently provided virtually. And we understand that every organisation across adult social care has nuances and that you are all unique. Therefore, the support and advice we provide cannot be generic. And whilst I've given pointers within this presentation, it is essential that we look to what you do specifically and give advice based on that. For advice for one organisation may not be the same for a similar organisation within the sector. Therefore, it's essential that we match our associates who are in the field and their expertise to the clients and to the services and support that they require. We understand the difficulties that the sector has gone through, the resilience of the workforce, and the resilience of the businesses that are out there. To recap, advice and support must be around the unique nature of an organisation. Generic advice just doesn't cut it across adult social care. There are so many unique services. While government guidance is very generic across, you must consider that and kind of filter it down for your organisation. And then additionally do risk assessments to consider how it can be implemented and the positives and negatives of doing so. Training, policies and process. We must ensure that we keep up to date and that we communicate these from the areas of governance, oversight, quality assurance, all the way down to frontline workers, whether that be healthcare assistants, nursing staff, social workers, psychologists. It is important that we make sure everybody understands the changes that have been made within organisations. Don't forget the changes both personally and professionally that your workforce have had to go through. It's important that we make sure not just that the business is resilient, but that is dependent on the resilience of our employees. Asking employees how they are and considering personal needs as well must form part of your employee risk assessment process. These need to be continue updated. Where you're in doubt, you must go to Public Health England. You must seek support from local authorities and NHS trusts. Commissioners, support and advice are there to assist you where there are nuances in your service, where government guidance or PPE advice just doesn't seem to fit. You must make sure that you review regularly. Planning is essential as we move forward through these difficult times. Reviewing regularly enables us to be proactive and not reactive to stress and risks. Thank you for listening. I hope some of the points that have been made have been helpful. You can visit our dedicated COVID-19 hub where you can access specific information about furlough, frequently asked questions. There is also downloadable coronavirus job retention scheme and furlough booklets. You can also sign up for more webinars, which we will produce as we move through the current climate. Most importantly, in addition to the advice that given today, we also offer free legal support and guidance through 1 month free to our Law Hub. This includes guides, letters, templates, employee contract templates, and other documents you may find useful. Markel Care customers already have great benefits as part of their policy, and they will be continued to be able to access this. Once again, we thank you for listening. As part of the adult social care community, I thank everybody who has continued to act to support the vulnerable people across the UK.